My name's Halima Rashid. I'm Head of Transformation across Staffordshire and Stoke-on-Trent CCGs. And I was working on the Health Inequalities workstream as part of the vaccination programme. And one of the key things that we wanted to do was make sure that we're reaching out to these hard to reach communities or seldom heard groups to increase vaccination up to one of our core principles, really, because there was a recognition that people from certain communities, particularly BME communities, people from highly deprived areas, weren't uptaking the vaccine. So what we did was we worked with our system partners, and that included local authorities, community leaders, faith leaders, people from our CCGs, partners from providers, so lots of different people, including clinicians, to start engaging with these groups to understand, well, how can we increase our uptake and what is it that we need to do in order to support these communities and these and target these groups, really. So I think one of the key things that we agreed was actually pop-up sites would work. And the reason for that was actually people felt more comfortable, and one of the feedback that we were getting from our community leads were actually they'd feel more comfortable in a place that was more suitable to them, so like a place of worship, for example, or a community centre which they were actually quite familiar with. And what we wanted to do was dispel some myths as well, so utilise key prominent community leaders to support that. And we could do that through mosques, we could do that through the Black African Caribbean Society, for example, and we also had the Asher Centre as well, which supports refugees. There's lots of different people and lots of different organisations were involved to support. So we set up some pop-up clinics around mosques and community centres, and they were really, really successful. The feedback that we got from people was actually, thank you for bringing it closer to us, because we wouldn't have been able to travel further out into, so particularly in Burton, for example, we wouldn't have been able to travel out. So thank you very much for bringing it within the city centre. It was in a place that they felt a lot more comfortable with. So they were really keen in terms of getting involved, and the uptake was absolutely phenomenal. The feedback was great. And actually, we didn't just get to increase vaccination uptake. It was around supporting communities, talking to them about the vaccine. We utilised the fire service as well to support with roving team, and I think that's a key example of how we've utilised different system partners to actually work together and go out to communities and increase that outreach, really. So it shows that the work that we have been doing has absolutely worked, and the feedback that we have had from community leaders and faith leaders has been